The aim of this video is to demonstrate measurements of nasal patency. It is intended as a guide for staff involved in obtaining these measurements as part of the NAIROS trial. Please refer also to the nasal patency protocol and equipment manuals, and you may wish to check your local policies on infection control. The following topics will be covered in this video. Details of people you can contact for help regarding measurements of nasal patency. An overview of which measurements patients will have and when in the trial they occur. Equipment required to make the measurements. An overview of what will happen at each measurement visit. Details of how to measure peak nasal inspiratory flow rate. Details of how to measure the nasal partitioning ratio, and details of how to give the decongestant spray. If you have issues making the nasal airway measurements we are about to show you, or you need any further information or advice, please contact Alison or Eric using the details shown here. NAIROS patients will undergo airway tests after they have given written informed consent to enter the study. All participants have nasal patency measured at 3 points in the trial. The first at baseline, the second at 6 months after the date of randomization, and the third at 12 months post-randomization. At each visit, you will make measurements both before and after decongestant. 2 types of measurements are made: peak nasal inspiratory flow and nasal partitioning ratio. Nasal partitioning ratio measurements will be made both during maximum inspiration and the normal breathing cycle. To make the nasal patency measurements, you will need the following equipment: a method of timing to ensure that measurements occur within the appropriate intervals, tissues, peak nasal inspiratory flow meter, face mask. These are single patient use. 1 mask is used per patient per visit, and the same mask is used for both pre and post decongestant measurements. They come in 2 sizes, size 4 marked in green, generally suitable for females, and size 5 marked in orange, generally suitable for males. Use your judgment to choose the best fit. Rhinospirometer device with USB cable. Laptop or computer with rhinospirometry software installed. 2 filters, 1 for each nostril. These are single patient use. 2 filters are used per patient per visit for both pre and post decongestant measurements. 2 rhinospirometry adapters. These are reusable. 2 nose pieces, red for the right side and blue for the left. These are single patient use. 2 nose pieces are used per patient per visit for both pre and post decongestant measurements. They come in 2 sizes, medium and large. Most patients will use large. Use your judgment to choose the best fit. A plastic bag for storage of the face mask, filters and nose pieces between pre and post decongestant measurements. Decongestant nasal spray. Nasal patency case report form, 1 per patient per visit. A means of cleaning the equipment between patients. We use detergent wipes. You may wish to check with your infection control group. The sequence of events for each patient visit is as follows. The patient will arrive and be greeted. They will undergo acclimatization by sitting for at least 20 minutes in a quiet room with stable temperature and humidity close to that of the measurement room. They will be taken to the measurement room and trained in use of the equipment. The pre-decongestant measurements will be made. The decongestant nasal spray will be given. The patient should return to sit in a quiet room with stable temperature and humidity as before, whilst the decongestion takes effect. Finally, the post-decongestant measurements will be made. These should be started no less than 5 minutes and finished no more than 1 hour after the decongestion is given. Use a timer to make sure this is the case. We'll now look at each measurement in detail, starting with peak nasal inspiratory flow, abbreviated to PNIF. The aim of the PNIF measurement is to assess the maximum rate at which the patient can inhale air through their nose. Airflow is measured through both nostrils together. In order to make the measurement, bring the patient into the measurement room after at least 20 minutes acclimatization. Complete the date, study ID, site ID, your name and the visit on the top of the case report form. Ensure the patient is sitting in a comfortable upright position with their arms and legs uncrossed throughout. Ask the patient to gently blow their nose. Ask them to remove glasses and, where possible, anything else that would affect the seal made by the face mask. Choose the appropriately sized face mask, remove from the packaging and attach firmly to the PNIF meter. Reset the meter by holding it upwards and tapping the bottom with enough force to dislodge the magnet. This moves the red marker to the start position. Then carefully turn the PNIF meter upside down to return the magnet to the top. Tell the patient that when making the measurement they should exhale fully, cover their nose and mouth with the face mask, and inhale through their nose with maximal force, in other words sniff, with their mouth closed. This should be a short, sharp, inspiratory action lasting up to 1 second. The face mask should be placed high enough so that the inflatable ring does not touch the nose and with enough force to create a seal but not distort the nose or face. Allow them to practice the technique until satisfactory. Once they have the correct technique, make 3 measurements, resetting the PNIF meter and recording the result on the case report form after each one. Ignore and repeat any tests with incorrect technique so that 3 valid results are achieved. When reading the result, judge accurately where the red marker is on the scale without rounding to the nearest graduation. After the pre-decongestion measurements, remove the face mask from the PNIF meter and ask the patient to keep it in the plastic bag ready for the post-decongestant measurements. Clean the PNIF meter. Next to a look in detail at making measurements of nasal partitioning ratio, abbreviated to NPR. The NPR is an indication of the asymmetry of airflow through the nostrils. It measures the volume of air that passes through each side of the nose separately during breathing. In order to make the measurements, power the rhinospirometer by connecting it using the USB cable to a laptop or computer that is switched on. The rhinospirometer must be powered for at least 5 minutes before the measurements are made. These plastic parts at the end of the tubing are called flow heads. Connect the adapters to the larger side of the flow heads. The adapters are reusable and can be left in place. Connect the filters to the adapters. The filters must be in place before any measurements are made because any moisture inside the flow heads will stop them working correctly. Connect the nose pieces to the filters, matching red to the right side and blue to the left. The right and left sides will be indicated on the flow heads either by labels or by red and blue colour. Open the rhinospirometry software on the computer. On the Patient Record tab, type the patient's initials, not their name, in the name field and their NAROS study ID in the ID number field. The data will later be sent by email, so should not include any patient identifiable information. Explain to the patient that when making NPR measurements, they should cover their nostrils with the nose pieces, with the pointed parts forwards and matching red to right and blue to left, with sufficient force to create a seal but not to distort the nose. First, perform the maximal inhalation NPR measurements. Press the reset button on the front of the rhinospirometer to zero the values. Press again if necessary until both values reach 0 and are stable. Click on Acquire in the software and then click Record. Ask the patient to exhale fully, apply the nose pieces and slowly inhale the maximum capacity of the lungs through the nose with their mouth closed. When they've finished, click Stop on the software. Record the left and right volumes from the front of the rhinospirometer onto the case report form. Repeat this twice more, pressing the reset button on the front of the rhinospirometer before each. Ignore, delete and repeat any tests with incorrect technique so that 3 valid results are achieved. Next, perform the resting, tidal breathing NPR measurements. Press the reset button on the front of the rhinospirometer to 0 the values. Click Record in the software. Ask the patient to apply the nose pieces and then breathe normally through their nose with their mouth closed until you ask them to stop. As the patient breathes, the volume values on the front of the rhinospirometer will increase during inhalation. Exhaled volume is also being recorded but is not shown on the front of the rhinospirometer. Watch the volume values, and when either one reaches or exceeds 3 liters, or after 60 seconds, whichever happens first, click Stop, then Close on the software and ask the patient to stop. Record the left and right volumes from the front of the rhinospirometer onto the case report form. Only one measurement of tidal breathing, NPR, is required. Ignore, delete and repeat any tests with incorrect technique so that 1 valid measurement is obtained. Invalid readings can be deleted from the software by right-clicking on the entry in the left panel of the software, then clicking Delete, then Yes. There should now be 4 entries in the left-hand panel in the software. Click Save in the software and save the data with the naming convention detailed in the nasal patency protocol. After the pre-decongestant measurements, remove the nose pieces and filters from the rhinospirometer and be careful not to remove the adapters, and ask the patient to keep them in the plastic bag for the post-decongestion measurements. Clean the rhinospirometer. Click New in the software. Click No to the message about saving as long as the data has been saved already. After the pre-decongestant measurements, the decongestant spray should be given. Let the patient know that the spray will numb their throat and that this is a strange sensation. Deliver 2 squirts into the first nostril, ask the patient to sniff, then deliver 2 squirts into the other nostril and ask the patient to sniff again. Record the time at which the decongestant was given on the case report form. The patient should return to sit in a quiet room with stable temperature and humidity as before, while the decongestant takes effect. The post-decongestant measurements must start no less than 5 minutes and finish no more than 1 hour after the decongestant is given. The post-decongestant measurements should be carried out in exactly the same way as the pre-decongestant measurements, including saving the second data file from the software with the correct naming convention. In addition, record the time that the post-decongestant measurement started and finished onto the case report form. Write any important observations in the comments box on the case report form. Send the rhinospirometry data files by email to the NEROS Rhinospirometry Data email account, tnu-tr.nerosdata@nhs.net. 2 files should be sent per patient per visit, 1 for pre-decongestant measurements and 1 for post-decongestant measurements. Finally, enter all of the information from the case report form into the study database. Thank you for watching this video. If you need any further information or advice about these measurements of nasal patency, please contact Alison or Eric using the details shown here.